Let's welcome into the show now. We're into the second sign-up period for the Affordable Care Act. Dr. James has a website called Diamond Physicians, kind of boutique healthcare. I want to welcome him into the show. He's been following this thing from the get-go. Let me start off by asking you this, Dr. James. Has healthcare reform been successful in any aspect?
Unfortunately, it has not. The Affordable Care Act is anything but affordable. It allows people access to health insurance, but it decreases access to health care, and that is the most critical component. Can you see your doctor? And unfortunately, the tides have turned, and people cannot get in to see a physician. I've seen it in my own practice. Unfortunately, we don't take insurance. We charge a monthly membership fee, a low fee. Our clients receive unlimited visits, no copay, and 24/7 access to their physician via cell phone, text, and email. So it's a completely different healthcare delivery model that guarantees access to your doc, and that's the most important case.
Because that's what I go to a doctor, I pay him cash, and it's worked out fine. I do not have healthcare insurance. Are the feds looking for me?
They will be. You know, the penalty for the first year is $95, and then the second year it's going to be 1% of gross income, but they don't have a means to collect those funds, so they can't fine you. They will garner your wages if you're owed a tax refund. They will take the money out of that refund, but if you don't owe, the government doesn't owe you any money, they can't enforce that penalty. So it's an odd law. There's all kinds of intricacies that don't make any sense. It had a great idea, a great premise. I agree that people should have access to health insurance, but let's go with some free market capability here. Let's introduce cost transparency, which is what my practice has done. I offer 90% discounts on labs and imaging because I've contracted with third-party payers a low negotiated cash pay rate. So I charge $5 for a CBC instead of $70. $6 for a cholesterol check instead of $128, $400 for an MRI, which is normally a $4,000 to $5,000 test. Why does it cost so much? It doesn't make any sense.
They're not good policies, but I think it is a lot of the appeal for people. I have health care insurance. I'm safe. I'm protected. Now I've got the insurance. Is that the appeal?
Yeah, you know, on the surface it looks great. Hey, I've got this policy. When I go to the doctor or when I go to the hospital, my bills will be covered. But unfortunately, when they receive that bill, they get sticker shock because a lot of times these hospitals are out of network. So you think you're going in and you think you have a copay of $100, and then you receive a bill for $9,000, like the gentleman in New Jersey when he went into the ER, had insurance. All they did was put a Band-Aid on a cut. He didn't even need stitches, and he got a bill for $9,000.
That's the scary reality of it. Dr. James from DiamondPhysicians.com joining us on the show. So what's the solution? Before we wrap this up, you know, we hear about other countries all across the world that healthcare is just something that's offered. It's almost an inalienable right. Could we ever follow that model here in the United States of America?
You know, I think the answer is direct medicine or affordable concierge. Diamond Physicians is the answer to our healthcare solution, healthcare crisis. Basically, what we did was we cut out insurance payers. That's what's driving up the costs. We introduced cost transparency and allow the consumer to choose. So if you knew how much that MRI cost, would you want to pay $4,000 or would you want to pay $400? The choice is simple. We just have to give Americans the ability to choose the best product for themselves.
All right, and it seems like that's going to be the difficult part, is getting to that point where we can tear away all this extemporaneous BS and get to the very root of it. Dr. James, DiamondPhysicians.com. By the way, so you've changed your business model quickly. You've changed your business model here over the past year. You take cash, you go and see customers working out for you.
Oh, man, it's the best thing that's ever happened to me. Quality of life's gone up. Time with my patients has gone up astronomically. The average face-to-face time with the doc is 8 minutes. I spend an hour with each of my clients. It's so rewarding. They can call me, text me. It's easy. It's efficient. I can take care of a lot of things over the phone.
But you said these people are paying cash. Does that mean they don't have health care insurance?
Some of them don't. Some of them do. Some of them still have traditional policies. What we recommend is that you go to a catastrophic healthcare platform where the highest deductible that you can get, and then lower your insurance premium as much as possible and use the difference to pay for Diamond. And we've done this on the private sector with employer groups. The small businesses in America are getting crushed. 50 to 150 or 200 employees. They have to provide insurance policies for their employees, and it's really expensive. So
it's almost like healthcare reform, despite its disastrous effects, it's been good to you.
Absolutely. It really has, and that's because I don't take insurance. We get paid immediately, and we don't waste 60 cents on the dollar trying to collect reimbursements from insurance companies.
Unbelievable. Dr. James, always cool hanging out with you. Have a good afternoon.
You too. Thanks for having me on the show.